A 68-year-old man is brought to the physician by his daughter because of a 2-year history of forgetfulness and decreased concentration and a 6-month history of depressed mood. The daughter states that he frequently misplaces his keys and other familiar objects and sometimes forgets where he is or the correct date. He does not take any medications. Physical examination shows facial twitching. Babinski sign is absent bilaterally. Mental status examination shows deficits in short-term memory. Laboratory studies show no abnormalities. A CT scan of the head shows diffuse atrophy with enlargement of the lateral ventricles. MRI of the brain shows hippocampal atrophy. What is the most likely cause of the accumulation of abnormal proteins in this patient's brain? Please put your answers in the chat now. Great, so we have everyone's answers in the chat. I'll invite Dr. Nori to discuss.
Imagine that this is a patient that you're taking care of on a medical team or in the emergency department, and already just by this vignette, your differential diagnoses muscles are kicking in and you're arriving at basically a couple of choices for what might be causing this type of dementia that is multifactorial and involves several cognitive and motor functions.
There's a couple of neurodegenerative diseases that cause forgetfulness and depressed mood. But for the MRI study that showed the hippocampal atrophy, that's more specific towards Alzheimer's. So that's why I was kind of thinking along those lines.
Yeah, Chris, I agree. I was also thinking Alzheimer's just because of the chronicity, the 2-year history of forgetfulness, the fact that it's short term, the fact that there isn't any personality changes or anything that would indicate frontal lobe. Babinski is absent. The only thing that threw me off is facial twitching because labs were normal. And I guess I wasn't really aware that Alzheimer's could cause that, if that is indeed the correct answer. But just anecdotally, like you always hear about patients misplacing their keys and forgetting, the correct date, and those are all warning signs. So I think the imaging confirmed it for me.
I have to say that my heart is swelling as a geriatrician to hear first and second year students talking so eloquently about dementing illnesses. So this is great. Anyone else?
So definitely whenever you aren't given answer choices, you're kind of directed towards relying on your own thought processes. So you can't rely on any distractors or any other options that may be given. Some of the things that stood out to me were the presentation, the time it took for his symptoms to present, the information that was given, and then following up with that, the specific symptoms that he was lacking, such as the Babinski sign, him not being on any medications, having a bit of forgetfulness. And then also at the end, I think as you read the question, you have an idea of what you might think it is, and then you come across other information that might help solidify what you're thinking. So for me, it was the diffuse atrophy and the enlargement of the lateral ventricles, for example, in addition to the hippocampal atrophy.
Like we all mentioned, not seeing the answer choices can be daunting. And I started second guessing myself, thinking maybe I need to think further down the line beyond Alzheimer's, what processes you're more specifically asking about. But then when we all answered, and to see us all thinking on the same page.
Right, and that's certainly validating for the test development processes when we can ask a question that can be reasonably answered by a knowledgeable student without seeing the option set. So those are all great points. And certainly there's higher order thinking skills going on here too, because you're seeing somebody with forgetfulness or cognitive impairment, but you're recognizing the time course here and what that means. You also see one of the 3 Ds mentioned. You got depression, delirium, and dementia, and depressed mood is already mentioned here, and these things can certainly all coexist.
When I was reading this question stem, really it became like a snowball, if you will, where you saw one thing, you're like, oh, I'm thinking it might be, maybe it's Alzheimer's, but okay, I still got to think about frontal temporal, dementia, some other causes that are on my mind. And then I really liked how this question stem gave us a lot of information to effectively pick an answer. We haven't seen the answers yet, but to narrow down your diagnosis, and having laboratory studies given to you, at least saying there's no abnormalities, and then no medications to worry about for side effects. I think that really goes to the quality of this question stem.
There's certain features of this that seem very consistent with something like Alzheimer's. If that were to be your guess, if one of the choices pointed toward a diagnosis like Alzheimer's, you know, in real life, that is the most common cause of dementia in this population. So if that were to be your guess, you have a reasonable choice of being correct if you are actually taking care of this patient. However, broadening the differential for other types of dementia, one of the ones that Zach mentioned is, of course, frontotemporal dementia. Thinking about where that disease strikes will help you kind of understand what clinical symptoms, signs and symptoms to expect. What are the features here? What are the signs and symptoms that are being recognized during this gentleman's presentation? Well, clearly he has signs of dementia and mood symptoms accompanying that, but he also has certain other physical findings. He has some facial twitching, which kind of threw us all for a loop. Not really sure what to do about that yet, but could be important. So let's hold on to that. And then also the sensory finding of the dropped Babinski sign bilaterally. Is that important or is it not? Also something to kind of hold on to as we explore the question choices. The CAT scan finding is not particularly specific. I think you may find that in lots of types of dementia, but the MRI finding may be more specific. So while if you are a betting person, there's a reasonable chance that in real life, this is a presentation consistent with Alzheimer's disease, let's see what the question choices are and what that might reveal about what the item writers are thinking in terms of getting you to arrive at the right diagnosis.